Hello, my guest today is Norine Vanderhooven. She's a clinical social worker and she has decades of experience working with trauma, with young patients, and with suicide related issues. For the past 3 years, she has been a chair of the Youth Suicide Prevention Committee of the American Association of Suicidology. Thank you so much for being with us, Noreen.
No, thanks for having me, Paula. This is wonderful.
I'm so glad that I talked to you and you agreed to be a guest in my podcast and my YouTube channel, because I listened to a podcast you talking and so I have to have her talk to us because she just has this wealth of experience in this area.
Oh, thank you. Yeah, the more I can share the information, the happier I'm happy to do it.
Yes. Can we start talking about the youth population? We're talking about 15 to 29 or 30, 32. Why should we worry about this population, Noreen?
The really concerning thing, Paula, is in the last several years, the numbers not only continue to climb, but the age range continues to climb. So, back like in 2017, it was between the ages of 10 and 24, suicide was the second leading cause of death. Now it's between the ages of 10 and 34. So the age gap has widened, which then obviously increases, those numbers as being for the second largest cause of death for that. And so it's very concerning because even, the younger kids, they're not resolving those, their issues and their problems, and they're not finding ways to cope with it. And so then as they get older, of course, those things continue. And so that's why we're seeing it spread into the, upper age ranges of, between 25 and 34 as well.
Wow. And, from when I look at the statistics, the number that scares me the most is the number of suicide deaths within the age group of 10 to 14 from 2000 to 2017. It almost tripled. How can you even explain that, Noreen? What is behind all this increase?
It's so sad and it's so frustrating because we try so hard to work to decrease this. Yet a lot of what's happening is, family dynamics is a huge part of it. When children struggle and parents don't pay attention, or parents feel like, oh, they're manipulating, or all these other things, that they don't take them seriously, and then they sometimes wait until it's too late. And the other big piece that has played, recently in the last several years is peers and social media. There's so much going on social media, and peers are feeling. One of the huge things, Thomas Joyner out of Florida State University, who's the interpersonal psychological theory of suicide, the mouthful.
Yeah, I've read his book, and I was fortunate to interview him for my book.
Yeah, and so the three things that he talks about is, like the lack of belongingness, the burdensomeness, and then the capability. And so that lack of belongingness piece is so huge in this age group because, they feel left out of a peer group, and, that's all it takes for them to continue to spiral. That's that one piece. And then you have the other piece, and they're feeling a burden to their families and their parents. And, so start putting that all together, and it becomes that perfect storm when people just aren't paying attention and giving them the support that they really need.
So these are two big pieces. What else is behind the numbers?
I really think that from what I see in my practice and from what we've seen, that's a big piece. With this last year, our committee worked with the Boys and Girls Club of Columbus and Nationwide Children's Hospital to put together a program for the Boys and Girls of Columbus, because they wanted a program that addressed exactly that, like, who is a safe adult that you can go talk to, and how are you able to like decrease the stigma, which is such a big thing. That's another really huge piece of stigma, that nobody wants to talk about it. No one wants to say, oh, I'm depressed, or I'm anxious, or, I have mental health issues. And so those are really big pieces to be able to disseminate to this, young population. And then another big piece is family history. So, when someone dies of suicide in one's family, that number goes up exponentially as a risk for other people.
Yeah, it's you mentioned that, and I was thinking about my own example, because from what I see in research and also talking to people for more than a decade now, especially families who lost loved ones to suicide, in a way, when someone does that in your family, it opens the door. It becomes an option.
Yeah.
But
exactly.
and it can have the reverse effect too. With my sister,
Yeah.
for example, at the time she was struggling with depression, but she wasn't doing treatment. And when my father died, I remember her calling me and saying, I have to start treating myself because I have a daughter and I will not do what he did. So for her, it
Wow,
was the
that's
opposite.
wonderful.
Yeah.
Yeah.
But I can see how that can be a predictor to suicide, because until then, if you don't have history, if you've never experienced it, it's a totally shut door, right? It's not even there
Yeah.
because you don't think about it.
Yeah. And along those lines, the other thing is so Julie Searle, who is one of the past presidents of the American Association of Suicidology, did a research study called Not Six, because originally when the field of suicidology started, Ed Schneidman came up with, when someone dies by suicide, 6 people are affected in their circle, right?
Yes.
So her study, I believe, showed in upwards of 135 people are affected. And, all it has to be is that person knows someone who knows someone who knows someone, and that spider web that then kind of, spreads out. And that includes youth. Youth are not immune to that. So, what if one of their friends die by suicide? All of those people, are then affected. And
Yeah,
it kind of like opens that door, like you said.
Yeah, and it's for this population in particular, it's contagion is there, and it's even higher than with adults, isn't it?
Yeah. In general, I believe the contagion is like maybe 2 to 5% generally. But with youth, it does tend to seem to be higher. I don't know exactly what the numbers are, but just from what I've seen in communities happening, that tends to be true.
Well, it does make sense. I mean, they're teenagers, right? They
Absolutely.
look up to their peers, their friends are the most important thing. And in this case, when they do have problems and they have the family dynamics complicated in a way, they don't feel like they can go home with that. So I can totally see. And I remember when Netflix came up with that series, there was a huge conversation worldwide. I remember because I was interviewed, people would call me, Paulo, what do you think about the series? And I'm going, oh my goodness, I just can't believe. Anyway.
Yeah, very distressing.
Yeah, it was very distressing at the time. Can we talk about warning signs? Do they usually give warning signs? Because I know adults do, but is it the same with youth?
Yes, absolutely. Anybody who is thinking of suicide, there are always warning signs. And, maybe they might be, what I'm looking for, kind of more like underground, more subtle, not so. But, one of the things that kids in particular do, adults do this too, but, I found with kids is like give away items to their friends, even though they're like their little precious items. They start, giving those things away. They, they'll start making statements. So Jonathan Singer, who's the current president of the American Association of Suicidology, wrote a book with Scott Polland and Terry Urbacher, I think that's her name. And it's called Suicide in Schools. And one of the things is they have like a diagram in there. And so it says like, what is the statement? What could it mean? And then kind of what's that thought process? So like, if someone says like, it's just not worth it, or I can't do this anymore, or, I don't know what to do, or like those statements can be so ambiguous, sorry. And it's like,
Mm-hmm.
because they're ambiguous, you have to ask directly, like, so what do you mean by that? And
Mm.
if you don't know to ask that, like a lot of parents just think, oh, they're being dramatic,
Yeah.
or again, they're being manipulative, and so they don't ask those questions. And those kids are trying to get their message across and kind of saying help, and they don't know how else to say it. And
Mm-hmm.
parents or teachers or whoever are just missing that point. So, the one thing that like I always tell everybody is ask, and ask directly. I do a lot of trainings for colleges. So professors will call me and I'll just do like, a 1 or a 2 hour training for them on the basics of risk assessment and kind of,
Mm-hmm.
what to look for and warning signs. And that's the one thing is that with a lot of these new students, and so if you think new students have this, obviously lay people have this thought too. If
Mm-hmm.
you ask about suicide, it's putting the thought in their head.
Yeah,
And
that's
I
one
try
of the
to,
myths that I talk about in my book. I mean,
yeah,
everybody thinks
exactly.
that.
And
Yeah.
yeah, and I try and explain that it's already there. If it's
Yeah.
not there, they're going to go, no, what are you talking about?
Yeah.
That I'm not thinking about suicide.
Mm-hmm.
But if it's there, they're going to be relieved that you're asking them.
Mm-hmm.
Or if they're not relieved and they're scared about it still, because that's the other issue is a lot when for 5 years, I was the clinical supervisor of a children's mobile response team in our county.
Mm-hmm.
So we would respond 24/7 to anywhere within our county to provide the emergency mental health assessment. We would place the youth on a 72-hour hold, or we would engage in a safety plan if possible.
Mm-hmm.
And that was the one big thing with, I would say, such a majority of the kids is they felt their parents would be angry with them for having these feelings.
Mm-hmm.
And so they'd be afraid to talk about it. And so then that's why they just wouldn't talk about it. So it really is, oftentimes the response of the parent as to how that child will then respond.
What are the we're talking more about the verbal ones. What are the nonverbal signs that they exhibit?
Isolation is a big one, just change in behavior. So if maybe their eating is going to be different. Maybe they're just not eating as much. Either they're sleeping too much or they're not sleeping enough. Those are some really big ones. Moodiness. Their moods are just drastically, changing rapidly.
Mm-hmm.
And so those are kind of some of the nonverbal ones.
I've read that also they become, and this is something also that maybe for a teenager, the parents won't even associate it with anything suicide related, but they become very interested in death related things, music,
Yeah.
books about death, or movies.
Yeah. And a lot of times, what I have heard is when people go back to look on the computers to see like what the history is after, they find all of this history of that's what they had been researching.
Mm-hmm.
So that's also something that often the parents don't even know about. It's not like they often even just talk about it. They just go and do this. And then it's kind of like an after thing that they find. But, the other thing that happens is kids will get very angry. So in children, depression comes out very differently than it does in adults.
Yeah.
And in children, oftentimes when they're very depressed, they express it as anger, irritation, being short, and curt. And that's really signs of depression, but parents don't see that. They just think,
maybe he
angry
or she is
and
spoiled or something like that. It's a
yeah.
tantrum. It's a
Yeah, and
phase.
they're being reactive. Yeah, exactly. Exactly.
So what can parents do, Noreen? So first of all, always pay attention if they're saying something like, I don't see the point, or there's no point in living. I don't want to wake up tomorrow. So
Yeah.
pay attention to the verbal signs. But I find it really difficult to, and I would like to hear your opinion on this. I mean, what can they actually do? So they'll go talk to their kids, ask directly about suicide. And what if they
Absolutely.
say, yes, I am thinking about ending my life? What are the options that they have out there?
You know what? Immediately contact a mental health professional to be able to get them seen, and make sure that you do not leave them alone. I think that's the big thing is that parents will go, okay, you know, tomorrow we'll call a therapist and we'll get you in to see somebody. And they're genuinely trying their best because that's what they think, but they don't think, oh, okay, I'm going to go to sleep and maybe my child's going to, you know, kill themselves while I'm sleeping. So the important thing is, you know, to make sure that they are safe and to make sure that you stay with them until you do get help. And, you know, different counties and different states operate differently. The way our county operates is that's kind of what our job was on that mobile crisis response team. It was a 24/7 hotline. So they can call 3 o'clock in the morning and we would go out to assess their kid to make sure that the kid is safe and they can engage in that safety plan. Or as a last resort, if they just could not be safe and they were intent on following through, you know, that night, then we would place them on a 72-hour hold. So, you know, it's really paying attention and being there and not just, you know, kind of going, oh, okay, yeah, we'll take care of it, but actually do something about it and talk to them, ask them, you know, how can I be of help to you? Is there anything that I can do? What is it that you need? You know, really just be there and be empathic. And, you know, the other kind of key things that are often mistakes that people do is they'll say statements like, oh, I know how you're feeling, you know, but you don't know how they're feeling.
You don't know.
Like, you don't, you know, so you can say, I'm so sorry you're going through this and I'm here to help support you however I can, you know, and I don't know what you are going through, but I'll try to understand as best as I can and be there with you, you know. So it's like you can give them those messages, but, you know, when you start saying other things, you know, kind of like the, oh, I know what you're going through, it's very discounting in a lot of ways to them. And so that makes them, you know, just kind of more either angry or depressed or suicidal.
You mentioned Edwin Schneidman, and I just remembered, this is something that I mentioned in my book, and I was so fortunate to talk to him a few months before he died. Can you imagine?
Oh, wow.
Yeah. And one of the
he was
things,
a special man.
he was so sweet. I just couldn't, I was so happy to talk to him. And one of the things that I never forgot was, these are the two questions you ask. Where does it hurt and how can I help? Right? Yeah, so that it is basically what, and please no judgment. That's the main thing, to know this is right or wrong, or don't be harsh with them and don't be angry, because it's just going to make it worse for the kids.
Yeah. And, you know, I always tell the story of, do you know who Kevin Hines is? He wrote the book he wrote a book called Cracked But Not Broken. And he actually jumped off of the Golden Gate Bridge and he survived. But
I've heard his story, but I haven't read the book.
His story's amazing, and the book is unbelievable. And he has, I think it's on iTunes now. You can get it. It's called The Ripple Effect, and it's a movie, you know, about how suicide affects people. And but what he says is that when he was on that bridge and he was contemplating it, that he said, if just one person would have said to him, are you okay? He wouldn't have jumped.
Yeah.
But people are oftentimes just afraid to even ask that. So it's like, don't be afraid, you know, please, please, please ask. That's just so important.
Yeah, I get people contact me through my website many times. And I always think, for someone to contact a stranger, I mean, it has to hurt a lot, because that's what I am, right? I'm a stranger to them. And many times that's all they need is for someone to respond and say, I care.
Yeah.
Well, one topic that I know is in the radar for many parents today is social media. You already touched on that. But how can they know? Because this is the big question now. I mean, how long should I let them stay on the phone? I mean, up to what point is it healthy or unhealthy? So how can you help parents understand that? Because I was looking at a survey with more than 500,000 kids, between the ages of 13 and 18. I don't know if you saw this, but the conclusion was that when they had more than 3 hours of screen time a day, they had a 34% higher chance of having a suicide-related episode.
Wow.
Yeah. So I
Yeah,
think it's a lot, 34% of, so over 3 hours,
it's huge.
more than 34%. So what can you tell these parents? I mean, how can they control that, or is it even possible?
I think it starts the younger, the better. And I think that's part of the problem is that parents, um, you know, don't really see the harm in their like younger kids going on the iPad and watching
Mm-hmm.
movies or, playing games. But then it does turn into social media as they get older and those boundaries have not been set. So it's really that parent is the one,
Mm.
technically, it's their phone. It's their phone. It's their money that's paying for it. They're the parents. They run the household. They have to set the boundaries. And, when they see, the big thing is like when they see if their child is starting to isolate more, or their child, is starting to spend more and more and more time,
Mm-hmm.
or if their child's mood is changing, they really need to step in prior to that, even to set those boundaries of, this is how long you'll be on. And, one of the things I always talk about is when you're sitting at the dinner table, put your phones in a different room, you know? And when I was on the crisis line, I was not afforded that luxury because since I was a supervisor, it always had to be there. And so, of course, at the time, my kids were younger. And so I was like, why do you get to have your phone? I'm like, this is not a choice. This is, I'm not
Mm-hmm.
playing games. I'm not talking with friends. And even now it's my 19-year-old is home from college and, I'll have to tell her, put your phone down or put it in the other room. Like we're not on social media or right now we're having dinner. This is it.
Mm-hmm. So set
But
boundaries since early age, because
absolutely.
you made a good point, because that's how they start. The parent will give their tablet or their phones for them to play these harmless games of, babies jumping or something. But that's
Right.
how you start, right?
Yeah. Yeah. And then what happens is, so as they get a little older, they think that they kind of have like this carte blanche with the phone because
Mm-hmm.
they've never had a boundary, set for them when they were younger. And so that's the key thing I think in any part of really, parenting is boundaries. Is you really
Mm-hmm.
have to set boundaries and rules. And it's not always going to be the most popular decision, but you have to do what you know is going to be safe and appropriate for your child and your family.
Yeah, and the other thing to think about too is give example, right? Because if you're telling them we're here eating dinner and you have your phone on the table, it
Yeah.
sends a message, right? So it's
Yeah.
about giving your own example too.
Yeah, exactly. Exactly.
Hmm.
Even now, the only time that I'll have my phone is if I know I have a client in crisis. I want to make sure that I'm able to, get the call rather than it be
Hmm.
in the other room. Other than that, it's like there's no need, to have your phone with you. It's
Noreen,
good to take a break.
one more topic to help parents, because that's the main
Absolutely.
the main reason why I'm doing this. Schools. How can a parent know that their schools are prepared for suicide? Are they doing something towards suicide prevention, or are they prepared to talk about this? What kind of questions can they ask?
They can always call the counselors at the school and ask, like, what, do you have a plan in place? Now, I know I think it's in all of California, but for sure in our district, all of the schools have to have a place and plan for, suicide prevention or
Mm-hmm.
response. And I believe that they're starting to do more like psychoeducation. Like I've seen, even though my kids aren't in the school district anymore, I still get the emails. And so a lot of times they'll do more parent education seminars and talks and different
Mm-hmm.
things, which is
Uh-huh.
wonderful. So I would encourage parents to request that, so that they can learn more, they can make sure that their kids are learning more about it. And, knowledge is power. And
Mm-hmm.
so the more information you have, the better off you're going to be.
Mm-hmm. I had the opportunity to witness, there's a program here in some of the schools in Oregon. And by the way, I don't know if you saw the latest data, but now Oregon for youth is the leading cause of death.
Yeah, I did just see that. So
It
distressing.
jumped from second to one
Yeah,
to
yeah,
first. So I went to a school to see how they dealt with it, and they really opened my mind to this. What they do is they train the kids. It's not about parents, or it's not about the teachers talking, or the counselors. They train the kids, and the kids are the ones who go and make the presentations, to go into the classrooms, because kids listen to kids. They want to listen to
Yeah,
their peers. That's who they relate to more closely at that age. So it really had good results. So it's just a
that's
tip for
awesome.
schools. It's not about adults telling kids what to do. It's about kids talking to their peers.
Yeah, I know there's a local high school that has a similar program. It's like a
Mm-hmm.
peer kind of mentoring program.
Mm-hmm.
And I spoke to them, I think about maybe 4 or 5 years ago. I did a talk on, signs to look for and what to, kind of how to talk to your friends about it. And
Mm-hmm.
so, unfortunately, not enough schools have those programs, like you said. So I'm glad to hear that in Oregon, at least, they're starting those types of programs. And I wish they would do more of it out here.
Mm-hmm. Noreen,
Yeah.
the last topic that I know it's in the radar for parents too, self-harm, because
Yeah.
it has become so predominant with youth.
Yeah.
So
Yeah.
how can they know whether or not the self-harm is suicide related?
The first thing is to ask, is when they notice, like, if their child is self-harming, they need to ask the same thing, like, did you cut yourself? Are you wanting to kill yourself? Do you want to die? You have to ask very directly. Because if
Mm-hmm.
you ask, a lot of times I'll have parents ask, or I'll even have therapists ask their clients, oh, do you feel like harming yourself? Well, you're not talking about harming. You want to know if it's just self-injurious behavior or if it is that they do want to die because they're cutting. So it's really important, to ask that.
Mm-hmm.
And the other thing is, so self-injury is a risk factor. It is not the risk factor. I was just reading a study from, I think it was from Colombia, where a third of those youth who self-injured then went on to engage in a suicide attempt within the
Wow,
first
that's a
3
lot.
months.
That's very
That's a
high.
lot. Yeah, it
Yeah.
is high, but it's only within the first 3 months, and then after that, it like tapers down significantly.
Okay.
So that the first 24 hours, the first week, the first month are really, really key
Critical. Yeah.
in self-injury. And, it's not something just to not pay attention to. I think a lot of parents are really afraid of it. And so they'll see marks on their child's arms and they'll just go, oh, and then they don't ask.
Mm-hmm.
Well, make sure that you ask about it,
Mm-hmm.
and a lot of kids will start wearing, that's the other thing, if you notice that it's hot out, 90 degrees, and they're wearing long sleeves or sweatshirts,
Yeah.
ask,
That's a
like, what's going
sign.
on?
Yeah.
Yeah. So that's another sign. So it's like things, just
Mm-hmm.
really, awareness is the key. Awareness is a big thing.
Mm-hmm.
And ask.
Yeah. Noreen, how can my audience find you? You mentioned that you have a training course online for people who want to assess, and is it just for therapists or?
So it's for all mental health professionals, nurse practitioners, RN, so anybody in the mental health field. And that they can find the link to that on my website under resources. So it's no www, just HTTPS
Uh-huh.
colon / and then it's NorineVanderhooven.com, and they can find it there.
Well, I'll make sure I'll have, because I know your last name is not the easiest to remember.
It is not the easiest to remember.
So I'll just make sure I'll have that written down on my show
Awesome.
notes so my audience
That would
can
be great.
access it. And I will check it myself. I would be interested in taking the course for sure.
Awesome. Yeah, and actually right now it's, unfortunately with COVID-19 and
Yeah.
everything, we are seeing an increase in
Yes.
depression and mental health symptoms, and suicide rates are going to unfortunately start to go up at some point. And so I decided originally, it's a 6-hour class and there's a lot of information in it. And I dropped it by 80%, the price by 80%, because I wanted it to be
Of
available
course.
to
Yeah.
mental health
Yeah.
professionals, because now is such a critical time for people to be able to know how to, really assess somebody and ask those questions and what to look for.
Mm-hmm.
So,
Great.
so I have that. There are also resources on my, if parents go on or teens go on, there are lots of resources, hotlines, and organizations that they can
Mm-hmm.
link to.
Yeah, and the rates are going. I was looking at the numbers here in Oregon for the hotline. They have increased more than 40% in the last few days.
Yeah,
The
the National
suicide,
Suicide Prevention
yeah,
Lifeline as well.
and it's
Yeah,
been. I think in Massachusetts is the record high
yeah,
too.
Yeah.
Well,
Yeah.
I hope this helps parents. I'm sure they're
Yeah.
very grateful.
Well,
And
thank you
I'm
for having me.
grateful.
This was wonderful.
I'm grateful for having you here today. Thank you so much. Take care
Thank
of
you. No, I
yourself
love
and
being here.
keep yourself safe.
Thank you. You too, Paula.